The biggest problem with AI adoption is that, and it's a broad term because AI can cover lots of different things, is that we do have a tendency to think more about the harm we do by commissioning something versus the harm that we do by omitting something. So, when, for instance, a regulator says, we're not going to put this in because we don't know if it's dangerous or not, it's often not in the context of, well, dangerous is also not having enough doctors to see you in time. So I think understanding that it's not just about the absolute efficacy of things, but it's also about how it changes capacity is something which now regulators are learning about. And the other thing is just human behavior. Not many people in my profession trust computers because their lives are plagued by horrible user interfaces and having to do more work in order to capture things for billing purposes and auditing. Technology hasn't served a purpose that gives them joy in their work. And so they haven't seen the advantage of how even basic things can help, let alone a very advanced artificial intelligence like we're seeing, emerging very rapidly at the moment. Collaborations only happen when people meet, and they can meet in different ways. Okay, you can have WhatsApp groups, you can have you can have meetups and so on, but ecosystems, networks, they do need some photons, not just pixels. And so getting the right people in the room together where they can look at things they haven't quite seen before. Not everybody can keep abreast of everything. And so getting people in a room together, public sector, private, tech, very much on the research side as well, getting everyone in a room together and also entertaining them is extremely important. Good stuff happens when you do that, and it's important that there are forums for this, which is why I've contributed to it and looking forward to being on stage. The best place to apply AI right now is in catching things where we just don't have the ability to have enough pairs of eyes doing things quickly enough. So, spotting things that a very busy, tired radiologist might not catch, or when you don't have that radiologist and you're in the emergency room. So, you'll see things at the expo today around artificial intelligence applied to radiology, for instance. And that was regarded as really suspicious 5-10 years ago, and now it's becoming much more mainstream. So that's one of the areas. I think the other thing is in summarizing notes and preparing summaries for people to then edit and sign off. So we're not talking about automated diagnostics, but simply taking a long conversation and not having to then spend an extra hour after that hour typing it up. I think you'll find that will bring huge bonuses to the working lives of very, very busy clinicians who have got ever more to do and ever less time. And at very least, they'll be able to do twice as much in half the time, which is radically better, but also needed. My name is Jack Kreindler. I'm a physician, an extreme environments researcher, so austere environments like high altitude polar regions and things like startups, which are also a very extreme environment. I study people going through those environments, and my practice helps deliver solutions for those kind of people, either in extreme environments, the military, or in occupations that are hard to cope in. And we do so with biosensors, medical technology, a lot of things that will become sort of normal, I guess, in public health systems. And we've been pioneering that stuff for about 25 years.